So, hello everyone, my name is Hassan and you're welcome once again to Mo's Medical. So today I have a very special guest, right? And we're doing a series where I just talk to different medical students in the Caribbean and I just ask them about their school. So I get questions about other schools that I do not really have answers for. So I decided to do this series where I just ask other medical students about their school, and hopefully that could be beneficial to you guys. So the guest I have with me today is a very special one, and I'm just going to let her introduce herself. So go ahead.
Hello dear, my name is Lizzie and I'm a second year medical student at the Caribbean Medical School. The name of my school is Windsor University School of Medicine.
Okay, good. All right, so we're going to get into the questions, right? I'm going to be looking at my phone to be asking those questions. So answer as truthfully and honest as you can.
All right.
Okay. All right. So the first question, pretty easy. So tell us more about your school. So what's the name of your school? Where is your school located? Stuff like that.
Okay, so as I said, the name of my school is Windsor University School of Medicine.
Okay.
It's located in the island of St. Kitts and Nevis, but it's in St. Kitts.
Okay.
There's another island, Nevis.
All right.
The school is in St. Kitts.
Okay.
In Keon.
Okay. All right. Good. So how did you hear about your school and what made you decide to come here?
So I heard about my school from a past student who happened to be my mother's friend's daughter.
Okay.
So my mother's friend had a daughter that came to this school, and she told my mom about the school, and my mom was like, "Oh, okay, that would be good. That's nice. You could transfer there." And I'm like, "Alright, let's see what it's about." Okay. But when I was coming here, I decided to look at other schools, like look at other options.
Okay.
I looked at the Big Four, obviously, and costly.
So what made you decide to come here? So you said you checked out other schools. So why did you decide to come here?
I decided to come here because when I checked all the other schools, this was the one that I felt a little bit more at peace with. Mainly because another reason why I picked here was because I found out that they had a Nigerian student association with a large number of Nigerian students. So I was like, that would not be very foreign for me because first time leaving home and coming this far. So I was like, if I have other Nigerians around me, that would be, I'll feel a little bit more at home. So
all right, fair enough. To come to Windsor University School of Medicine, what kind of prerequisites can they expect?
Well, I feel it depends on your previous level of education.
Okay.
The prerequisite usually is that you should already have a bachelor's degree in a medically inclined course. Okay. I don't think
so it has to be medically inclined. So you can't come from like social sciences or from economics to your school.
Well, I haven't seen any. That's what I'm saying. I haven't seen any. Most of the people I've seen is biochemistry.
Okay.
And just medically inclined courses, nursing and all those kind of things. So that's why I keep saying medically inclined. I'm not sure. I haven't seen anybody come from finance and economics.
Okay, fair enough.
Yeah. So. The prerequisite is for you to have that degree. Then I don't think my school doesn't require the MCAT exam. So with that degree, you'd send your transcript to WES, World Educational Services, World Education Services for evaluation. They'll send the evaluated transcript back to Windsor, and
so what's World Educational Services? Is that from your school or is that just a body that accredits people's transcripts?
It's a body. I got to know about that body from my school because they were like, I have to send my transcript because I came from another medical school in Nigeria where I was in the MBBS program, and this program in my school currently now is an MD program. So I had to send the transcript for them to know where exactly I was and how they could integrate me into this MD program. So I sent my transcript to World Education Services. They evaluated it and they were like, the courses that I've done is for somebody that has done pre-med. So all the courses I had done so far, because I had done the first 2 years of the MBBS degree, so they were like, this first 2 years, the courses you've done is equivalent to the pre-med, so you start from MD1. So for other people, I have a coursemate who came from 300 level in the MBBS program, but he did not start from MD1 like me. He started from MD2. So I feel the World Education Services helps to evaluate your transcripts.
All right. So what you are saying is that based on, if you're in a previous medical school, based on how far you have gone, there's a possibility of coming here and continuing from when you start based on what the World Education Services thinks about your transcript. Okay. All right. That's good.
And you could also start from pre-med.
Okay.
You could also start from
So for people that have not had that much exposure, so there's a pre-med option.
It's even wiser to just start from pre-med if you don't have any previous educational background of any medically inclined thing. Like, don't play yourself, just start from pre-med.
All right, good. Okay. And so let's talk about tuition fees. So like school fees, what can someone expect to pay here? You know?
Well, the school fees range from 4,000 to 9,000.
4,000 naira? Okay, carry on.
It ranges from 4,000 to 9,000 US dollars. It increases as you go on. Like, I know the pre-meds are the ones that pay the 4,000 and some extras like $300 or $400 on top. So like 4,400. Then you come into MD. In MD 1 to 4, I was paying 5,490, so 5,500.
Okay.
Then it just keeps going. It keeps going higher. It keeps going higher depending on the semester you're currently in, and when you start your rotations. If you're doing your rotations in the US, there's an extra fee for that. So.
Okay. So, but the next question is, what's the curriculum like? Actually, I think that even segues into this. So, what's the curriculum like? So, first of all, how many semesters? Just tell us what the curriculum is like.
Okay, so my school offers the 4-year MD degree program. So, it's a 10-semester long program, and it's divided into 2. So, the first 5 semesters are basic sciences. The next 5 semesters are your clinical sciences.
Okay.
The school has a system-based curriculum.
Okay.
So when you first get into your first semester, you first do fundamentals of your core courses like anatomy, physiology, biochemistry, histology, embryology. You first do the fundamentals for those courses. Then you move on to the next system. The next system is musculoskeletal system. So you do everything: anatomy, physiology, biochemistry, embryology, histology, everything musculoskeletally related. You do that for that system for the next 4 weeks. Then you move on to the next system. Next system is cardio and rest. So everything cardio and rest for anatomy, physiology, like that. So that's how the curriculum is like. They just put everything together based on the systems. You move to the next semester, you still do systems. So at the end of your basic sciences, you should have completed all the systems in the body, all the anatomy, physiology, pathology, pharmacology, microbiology, everything, all the systems. You should have completed all the courses.
All right. So, also talking about curriculum, I know previously you mentioned that, so this is for basic sciences, right? So there's also a clinical portion. And you mentioned that, if you want to do your clinical rotations in the States. So what kind of options do you have for clinical rotations? Are there other options apart from the States where you could possibly do that?
So for my school currently, because I haven't started my clinical rotations, I don't really know if there are other options, but I know of 3 options now. I know you can do them here on the island in St. Kitts. You can do them in Jamaica. You can do them in the States. But for the States, you have to have written the USMLE Step 1 exam to be able to do your rotations in the state. But for doing them here and doing them in Jamaica, I don't think you don't need to write the exam. You can just finish basic sciences, write your exam for basics, then move on to start doing your clinicals.
Okay, interesting. So I have another question regarding that. I know we are just getting more questions. So if, for example, you do your rotations in Jamaica or the island, and you do all your rotations there and become a doctor, so can you practice in the States, or so what I'm not sure if you know that now since you haven't been there yet, but what do you think? So if, for example, someone comes to Windsor University School of Medicine, they do their rotations on the island or in Jamaica, and they're now a doctor. So, and you said that you don't have to take USMLE Step 1 for that, because I know to practice in the States you need that. So where can someone expect to go after being a doctor? So after being a doctor and you do your rotations in Jamaica or the island, where can you expect to work?
Well, I know that if you do all your rotations here on the island or you do them in Jamaica, you can work in the Caribbean. You write the Caribbean exam. I think it's called CARICOM.
I see.
You write that exam, and that would allow you to be eligible to practice medicine in the Caribbean, any of the Caribbean islands. If you plan to practice in the States, then you have to write the medical licensing exam for the States, which is the USMLE Step 1 and Step 2.
Alright, so there's that option if you want to just write those necessary exams. Then
you have to write the licensing exams to practice in the States.
Makes sense. It's housing on the island. So, where can someone expect to stay? So, is the housing, is it good? Is it comfortable? And what is the pricing like? And also, does your school facilitate that for you, or do you have to look for that by yourself?
Okay. So initially, when I was coming to the school, I thought the school will have hostels.
Okay.
I thought they'll have hostels where students can pay and stay like dorms, but they don't. So the school has a housing department that helps you to source for apartments or studios depending on your price range and your taste. So you can get houses from as low as, I think the lowest I've seen is $250 per month, and the highest I've seen is around $2,000 per month. So it depends on your taste. If you're looking for something extra fancy, you can get that. If you're not looking to spend so much money, you can get comfortable housing for good pricing.
All right, sounds good. Then so what's safety like on the island? Will you say the island is considered safe generally?
Yeah, since I've come to this island, I've not heard of any killings or robberies or anything extra. I think the island is considerably safe because my friends and I don't know, I'm not advising you, but when we stay late in the library, we walk back to our houses late at night and
nothing happens.
Nothing happens. So it's considerably safe. Don't be going out at night.
What kind of options are available for food here? Is it like local stuff, grocery store and all that? And does your school have a cafeteria on campus as well?
Okay, so for groceries, I would honestly advise if you're coming to this island of St. Kitts and Nevis and you are on any special diet, you're very picky about food, you're not trying to come and start trying new things, then just come with your food stuff, because something I noticed is that they don't really have variety. Like they have a good number of things, but they don't have variety. Like if you're particular about teas or I don't know, anything that you feel that, just come with your food stuff. Honestly, the food stuff you find here, they are good. They are quite pricey sometimes, especially when you're buying poultry and meats. They are quite pricey, but you still find a good number of things here. And my school has a cafeteria. They serve mostly Indian food, honestly, because the bulk of the population in my school are Indian. So they serve mostly Indian food, but they have chicken and fries.
So they
have chicken and fries, because that's all I eat when I go to the cafeteria.
So what of like breakfast
chicken
stuff, like eggs, pancakes and stuff? Do they have that?
I've never seen. Let me not lie. I don't like Gibuna.
Okay, I like you're honest.
Honestly, they have coffee.
All right, so eat at home before you start to go to school.
If you don't eat chicken and fries every day, because at the point that's all I was doing, I started cooking. Just bring your food to school.
To go some other route. So for those who want to practice in the States, I want to take the USMLE Step 1. How would you say your school, how well do they prepare students to take that exam?
Okay, so starting from MD1, because of the way the curriculum is tailored, I feel it's easier for you to study for STEP. If you're using the first aid book, you know that the book is arranged into systems, and that's how you are taught. So when you start studying for Step 1, it will be easy for you because that's how you learned it. If you learned anatomy, like just anatomy, everything anatomy in your first year, when you come and try to learn it system-based, it can be all over the place for you. So I feel the curriculum number 1 helps to prepare you for the STEP exams. Then I'm currently in my 5th semester. This semester is a revision semester that's preparing us to take our USMLE exams. That's if you want to take the exam. And so far so good. I mean, it's been okay. It just feels very rushed. It feels very rushed, but It feels rushed, honestly. It feels very overwhelming because they are trying to do everything you've done in your first 2 years in this semester.
Okay.
They're just trying to review it with us. It feels like a lot, but I mean, it's okay. They could do better. They could do better, honestly.
Okay.
They could do better, especially giving us more time to study on our own, because I feel putting classes, they put some classes where there are review classes, the lecturer is supposed to come and review stuff with you. But me personally, I don't get so much from those review classes. I rather use that time to study on my own.
Okay.
So the curriculum helps.
Okay.
This semester helps. It's helping some people. Some people are actually gaining a lot from it. But me, it's not like I'm not gaining anything. I'll just rather do it some other way.
Okay, and you also want them to give you guys more time.
More time, yes, more time.
All right. So your exams, right? So like a regular, typical exam for a medical school. What's that like? Would you say it's fair? And what kind of, okay, I won't say what kind of questions they ask you, but is it fair? You know, and so like how many exams you guys have before a final? I know some schools have like 2 midterms before one final, so they're only evaluated 3 times.
Yeah.
So in my own school, we have like maybe like 5 block exams for the final exam. So what is it like in your school?
So in my school, what we do is for every system, the systems are called modules.
Okay.
For every module, you have a formative exam. So if you have a 4-week module, 2 weeks into that module, you have a formative exam. This is just a quiz. It's not graded. It just helps you to know how well you're understanding, how well you are coping with that module.
Okay.
It's not graded, but it helps you to know. If you do well on that exam, most likely you do well on the final exam. So the final exam at the end of the module, that if it's a 4-week module, at the end of the 4th week, you write a summative exam. This one is now graded.
Okay.
So at the end of this exam, at the end of the module, you take the exam. It is most times 40% of your grade.
Okay.
You write this exam, and then you move on to the next module. So in a semester, there are like 3 modules.
Okay.
So that means for each module, you write formative and summative. So at the end of 3 modules, you would have written 6 exams.
Okay.
3 graded, 3 not graded. Then you write NBME exams.
Okay.
NBME exams are external exams, I think National Board of Medical Examination or something like that. So you write NBME exams, and these exams are also system-based exams.
I see.
So they will test you based on the systems you've done on that in that semester at the end of the semester. So these are now the final exams.
I see.
You take your NBME exams.
Okay, so from what I'm getting, right? So in a semester, for example, you can have like 3 modules. That's 3 different systems.
Yeah.
So the question you get from the school, from your professors, you have a summative and a formative exam, right? But at the end of the semester, you are evaluated with an NBME, and that's set as your final exam.
Yes, and that's an external exam, not our professors.
Okay. All right. So and you said what's the weightage for that one like? So you said the module 1 is like 40%.
Yeah. So the modular exam is 40%. The NBME exam is 30%. So you have 70 already. Okay. Then you have 10% coming from your ICM. ICM is Introduction to Clinical Medicine, your clinical skills. You have 10% from that particular course. Then you have another 10% coming from your something called oral pre-recorded presentations that we do. So every system you're giving a presentation. You make a presentation on a clinical case. They ask for your diagnosis and some other structured questions. You do the presentation, you record, and you send it to your lecturer and you're graded. That's 10% of your grade. Then the other 10% comes from something called TBL. TBL is team-based learning. Like every week, there's a particular lecturer that comes and there's a topic for that team-based learning. He gives you and your classmate questions. You answer individually. Then another set of questions you answer together as a group, as a team, explain concepts and all that. So at the end of that, at the end of the TBLs, you get a grade that is going to come together as 10%. So 40% from the summative, 30% for MBME, 10% from ICM, 10% from your oral pre-recorded presentations, and another 10% from your TBLs. That's 100%. So the pass mark is 70.
Okay, yeah, that was my next question. I was going to be like, so she just said like to pass like a particular, I guess so is it like
17.
Is it like a particular course or like semester or like
to pass every course is 70 and when everything comes together to 70
okay so 70% is a pass mark. If you get below 70 you have failed. So what happens when someone fails? So if you fail, do you have to repeat that particular course or semester? How does failure work in your school?
Okay, so you're taking things system by system. After every system you write an exam. So when you take your summative exam, that's a graded one, at the end of the semester, at the end of the system, the pass mark is 70. If you get anything below 70, you'd have to take a remedial exam a week after that. So if you write the remedial exam and you still don't pass, then you'd have to do that system again.
That particular system.
Yeah.
Okay.
But because it's system.
Exactly. Yeah. So how does
you can move to the next semester. You have, let's say you failed the second system, the middle one.
Yeah.
So when you move to the next semester, you do your first system for that semester. You cannot do the middle one obviously because you're doing the middle one from your previous semester. So you do that one, then you do the third.
Okay. So does that create like a backlog of systems?
It does.
Okay.
Because you'd low-key be carrying over one system like that. So
okay, and this only happens if you fail that remedial exam.
Yeah, if you fail.
So what happens if you fail the exam for multiple systems in a semester?
If you fail all all the systems for that semester, then you'd have to do the semester again. So
if you fail the first exam for the 3 systems, is there a remedial exam or do you just ask to repeat since you have failed 3? So
you do your remedial still.
So then if you fail that one, then you repeat the whole system.
And something is, if you fail that exam, right? If you fail that exam, let's say you don't get a 70, you still have other aspects to add up to it. You may get complete 30 in your NBNE or your ORPs and everything is complete. That's 60 already. Let's say you get 20% from the summative exam and you add it onto that, that's 80, so you pass. By the time they accumulate everything, all the aspects of the grade, and it still doesn't
below
get
70.
to 70, that is when you do not have to do it again.
Interesting, that's interesting. Okay, that's good that you guys have different avenues to get grades. For my school, it's different.
Okay.
Yeah, but you guys will see it on that video on my school, but now we're focusing on Windsor, so let's focus on Windsor. All right, so the next question here, what happens if you fail the course? So if you are retaking that system, do you have to now pay extra, or how does the payment work if you are retaking something? I
will not lie, I honestly don't know because
you have not repeated this.
I've just been going. I've been going straight, so I don't know.
Okay,
I think if you're repeating a semester, if you're repeating a particular system, I think we pay according to the number, like the course weightage, the credit units that you're doing for that semester. So let's say if you fail a big system like neuro and renal, that system was very big and it was like 6 credit units. You failed that one, I feel you will pay more than somebody that failed endo and repro. Endo and repro is like 3 credit units. So I don't know. I honestly don't know. I can't tell you that.
Sounds good. All right. Okay. So we have 2 more questions and they're juicy ones now.
Okay.
So what do you like and what do you not like about your school? So let's go with so we do like or dislike first. Let's go. What do you think?
I think we should start with the goods.
Okay.
All the ups.
Okay. Yeah. So let's know what do you like about your school?
Okay, so one thing I like about this school is the way the curriculum works.
Okay.
Because you have to write an exam almost every month, you're always on your toes.
Okay.
You always have to study, because it's not like the exams are left till the end of the semester where you can just play all through the semester. And when it's getting to the end of semester, you're like, all right, let's start studying. You have exams almost every month or every 2 weeks, because you have to write formative exams too. So you actually have to be studying. So I like that, because me personally, if I have to leave things to the end of this thing, to just become too much. So I like that. I like the way the curriculum is. I like the faculty, the lecturers, they are very helpful.
Okay.
Very, very helpful.
Are they knowledgeable? Will you say they're knowledgeable?
They're very knowledgeable. Most of our lecturers are Indians and they savvy book.
All right.
That's all I have to say. They savvy book. So I like the faculty too. They are very helpful. If you are not understanding something, you can email them and talk to them on WhatsApp. Most times they would call you aside, explain certain things to you again.
Okay.
So I like that. I like they're very helpful. They're very hands-on.
Okay.
With the students. So the things I don't like.
Okay.
Things I don't like. Okay, let me say one thing that I don't like. My school doesn't have any option for student loans.
Okay.
That's one thing I don't like. At all.
It's very good that you're bringing that up. Okay, so tell us more.
If you're not a US citizen, or you're not from maybe Canada, countries that have student loan organizations, then I don't know. I don't see any chance of you getting any student loan. You'd have to pay all your fees, your tuition, accommodation, everything you have to pay yourself, and that money adds up. It adds up real quick, and because you have 3 semesters per year, you're going to be paying almost 20,000 a year. So it's quite a lot of money. I know coming from Nigeria doesn't really have student loan organizations. So it was, at first I was like, are we really willing to spend all this money? Are we really willing to spend all this money? And even the student loan organizations that I saw in the States, because I checked those ones too, even the ones I saw there in the States, they did not recognize my school. Like they recognized the bigger universities like Ross and this thing. But when I was imputing my school name, they were like,
okay, so does that mean that an average US citizen now can't even get loans from the States?
I don't know.
It's not recognized?
Honestly, I don't know.
Okay.
I don't know. I think I would ask some of my classmates, but the student loan organizations I was seeing, they were not recognizing the school.
Okay.
Maybe it's because it's a smaller school. So that I didn't like that.
Okay. So something just came to my mind now. So you said a smaller school. So what was the class size like?
Okay, so the class size. Something I've noticed is that the class size ranges on the semester you come into school. If you come in the September semester, for some reason, that class tends to be bigger than when you come in January or you come in May. So the average class size, it's quite small. The average class size, I think the biggest class I've seen is 30 students.
30? And that's like on the higher side?
Yeah, that's on the higher side. Some classes have like 10 students, some classes have 15. I think my class has 18 or 19, sometimes 20 students. But I kind of like that because I don't know, it allows the lecturer to pay attention to every student individually. It's not very big classes.
But does that get boring sometimes?
I came from a school where we had like 100 and something students in class, and I don't know, I think I prefer this one. This one feels more intimate. It feels like your lecturer is actually paying attention. That one, I mean, there's no way a lecturer can know all 100 of you. Like, there's no way I can pay attention to all 100 of you. I can just come and throw a question at the class. Any of the 100 of you that wants to answer. But this one is more intimate. The lecturer knows everybody. I know your name. I kind of know your strengths and weaknesses. I kind of know how to address certain things. So I like it, honestly. The class sizes are small, but I like it.
Okay, good. Alright, so the next question and the final question is, if there was one thing you could change about your school, what would that be?
Okay, so if I had one thing I could change, I don't know the answer to this question. Let me think about it. Okay, so currently I know my school doesn't have this California accreditation, and that allows you to practice in all 50 states in the United States. But without it, you can just practice in a few
specific states.
So that's one thing I wish I could change, honestly. I wish they could get that accreditation. I don't even know if they're working on it, but hopefully they are. So that people can branch out and go somewhere else.
All right.
Yeah.
All right. Well, that's all the questions I have for you today, and thank you for gracing my audience.
You're welcome.
With your beautiful presence.
Thank you.
And so, by the way, she's also a YouTuber as well. She has a whole stuff going on as well. So, tell them a little bit about your channel.
Yeah.
As well,
so my channel is about medicine, beauty, and lifestyle. Because I don't believe that medical students should not have things that they like outside of just medicine. So I, for one, like beauty a lot, and I love a lot of lifestyle stuff. So that's what my channel is about. If you're interested in those kind of videos, he's going to link my channel down in the description box. Go and subscribe to my channel. We also filmed a video on my channel. Yeah, so you're going to see me when you go and subscribe. You're going to see him there too. So go and subscribe to my channel, guys. All right. So thanks again for coming on. And so yeah, stay tuned for the next one. I'm going to be doing other schools. If you have any questions that I did not ask but you have loved me to ask, please just comment below. And if there are any other schools you want me to interview a student, also comment that below. And until then, you guys enjoy the rest of your day, and see you in the next one. Bye.